Hello, everybody, and welcome to episode 10, season 2 of the Daily Pill, a live webcast sponsored by our parent company, Angel Home Care Services, a caregiving agency providing advice on peace of mind and direct home care services to families in the Dade County and Monroe communities, right here in South Florida. Uh, Today, we have a pretty cool guy with a pretty cool job, Dr. James Trice. He's a concierge doctor. He's going to talk about the benefits of concierge medicine and why you should, at the very least, find out if it's a solution you should consider for your family. I'm going to read this right off because it's not a big bio, but I always mess bios up, right? So, Dr. James Trice is an internist who served as a clinical assistant professor of the executive medicine group. His influence in the development and delivery of concierge medical care has established the highest standard and distinguished him as a clear leader in executive care. Dr. Trice attended the University of Michigan Medical School and performed his residency at the University of Virginia Hospital. He currently practices at the Agatston Center for Preventive Medicine in Miami Beach. Dr. Trice, good to have you here. Welcome.
Oh, thank you for inviting me.
Did you find the place all right? Did you get lost on the way in? Everything good?
All good.
All right. So I know that, and by the way, we're going to talk about concierge medicine, but I know at the end we're going to do like a quick wrap up on COVID because I know that's a big topic right now, and I know you're at the very edge of it. So concierge medicine. For someone on the provider side like me, who's always dealing with patients, it's very common for me to hear that term. But so many times when I talk to families, they're not aware of what what concierge medicine or what a concierge doctor does. So my first question to you is, let's just get right to it. What is concierge medicine?
So concierge medicine, it's a membership-based care service model where a retainer fee is basically paid to the practice, to the primary care physician for being their primary care doctor, essentially for access to that particular physician. And in general, with concierge medicine, it tends to be, very highly personalized, comprehensive care. There's 24/7 access. All my patients have my cell phone. Generally, they're same-day appointments. It's very focused on preventative care and early detection of disease. And I tell people the most important thing with concierge medicine is the coordination of care and having an advocate. And that I tell people in a kind of a simplistic way, your concierge doctor is really going to be your quarterback. Our U.S. health system can be very, complicated, convoluted, and honestly, you can get lost in it. I have, my parents. I've dealt with this personally. My parents have been in their 80s, and fortunately, my dad recently passed away. But I understand getting health care for my parents who are in their 80s. And if you don't, and it's since I know the system well, that's why I was able to, help my parents. But if you don't know the system well, having a concierge doc can help you maneuver within our system.
Yeah, I mean, I have a similar experience. I mean, my grandmother is 101, right?
Yeah.
And my philosophy is if it's not good enough for her, it's not good enough for somebody else's grandmother, right? So, but even when with what we know about how the system works, it's not easy. It doesn't mean you have it made. You have to you still go through all kinds of challenges at times.
Yeah, it's
Um,
very, yeah, it can be very difficult. You can get lost. So
yeah,
your concierge doctor, is your quarterback. He or she's going to, you know, help you maneuver the system. And like for my office, we make all the appointments for you. So if you need to see a cardiologist, see the orthopedic surgeon, all you to do is tell us the availability, and we make the appointments for you.
that's awesome. Um, and so, and this question is kind of piggybacks into the answer that you just gave. But how's concierge medicine different from traditional medicine?
Um, First thing is the retainer fee. There
Okay.
going to be a retainer fee. People still need to have their health insurance. So the retainer fee is on top of your health insurance. So like for my office, or, most offices are concierge medicine, there's, a lot of times there's not additional billing, but there is going to be a retainer fee. But other differences are the amount of patients that a doctor is going to see per day.
Okay.
So, that typical internist is going to see somewhere about 20 to 25 people per day. And a typical internist practice is somewhere about 1,500 to 2,000 total patients. For a concierge doc, in general, you're going to have, you know, less than 600 total patients. For our practice, our doctors generally have somewhere between 100 and 300 patients total. So a busy day for one of us is seeing 4 people a day
Wow.
versus 20 or 25. So,
That's surreal. Yeah. I mean, that's I remember you telling I asked you like what's the average wait time at the office, right? That was one question that I had for you. And what was it? Like you said, it was like no wait time? Like
no, yeah, when I've had to give a few talks to people, and I have a slide of our waiting room, which is empty, and I tell people now, that's of the talk that I give, that's the most important slide that I want patients to see and to remember, is that the standard going forward should be you should not have to wait for your doctor. Of course, the times there's going to be emergencies, but in
sure.
general, you shouldn't have to wait for your doctor. Physicians in general, and I could be guilty of this too, we haven't taken we typically have not taken our patients' time. We haven't valued our patients' time. So you all hear about saying, "Hey, I'm going to go to my doctor and I have to block the whole day," or "I'm going to wait an hour in the waiting room," or you know, with concierge medicine, that typically doesn't happen. And now with the pandemic, not only do we have to value someone's time, it's an issue of safety.
Correct.
Going forward, I think what I would tell people listening today, that's really important. So when you evaluate your physician, he or she, we need to respect your time. And, not only respect and value your time, but we also want you to be safe. And we are in a pandemic here, and even when this pandemic is over, I don't think things aren't going to go back to what they were before. And that one of those things is, ideally, no waiting in the waiting room.
Yeah. That, and then no waiting in the waiting room. And then I also asked you, uh, how much time do you spend with your patients? And then with your patients, and I remember you said pretty much as long as they want to talk to me.
Yeah,
So,
that's true.
so
I mean, if I had to say for a typical new patient is going to be, 2.5 hours, as if it's someone's a young person, really young, healthy
yeah,
kid, say 18 years old, that could be hour and a half or so. Then I've had some people fly in from out of the country. Some people have a long list of medical problems, and honestly, they've been here 4 hours. But
yeah,
it's not only for me to get to know the patient; it's for the patient to get to know me. It actually go. It's both of those sides are
correct.
really important. The that my patient actually has to get to know me and understand me. Yeah, it's really as long as the patient wants. We
Yeah,
will make the
that's
time.
yeah, and that to me kind of became how I would explain the difference between concierge medicine and traditional medicine. I would say, okay, traditional medicine, long waiting hours, 5 minutes with the doctor. Concierge medicine, no waiting time, 2 hours with the doctor. Right? It's like
Yeah,
it's
yeah, the typical primary care doc in general have about every 15 minutes you have a slot with patient, and usually that's about 6 to 7 minutes face to face.
yeah, that's great. That's crazy. So all right, so the third question, because I know that we time flies when we're having fun, and this topic is dear to both of us. So uh, what are the benefits? And I think again, we talked about from what is concierge medicine, the difference between traditional medicine and concierge medicine, and then the third question is kind of like piggybacking on those two, which is what are the benefits of having, and I think you touched on it initially, right? What are the benefits of having your own concierge doctor?
And I think what it really comes down to is access. It's going to be all my patients, they have my cell phone. You know, if,
Yep.
if they want to call me, if they want to text me, even when I've been on vacation before, and of course I'll have my partner would cover me. But if a patient has texted me or called me, and even with my partners, generally we still answer because we know the patient so well. You're able to say, oh, because you use a lot of things you can take care of still 5 minutes, and then actually patients are amazed when they say, wait a minute, you're in California and you just called in my meds for me, or you ordered this for me. I'm like, yeah, it's no problem. Um, so
Like,
that
who has the doctor's cell number? Just like who
yeah.
has the doctor's cell number? I mean, even if your buddies, doctors don't typically give out their cell number because that would mean interruptions, right? And then people calling me out of the blue, But
And you know what? In general, most patients, the vast majority of patients really respect that. I'd say 95% totally respect it. There's that 5% that are a little,
sure, sure,
but the vast majority of people, so the arrangement is fine. And I tell people that there's no such thing as a dumb question. You know, I've got the time, and if you have a question, answer, because sometimes it can make my job actually harder if you don't ask the question.
yeah.
So
No dumb questions, especially when it comes to your health.
correct.
You know. All right, so we covered those three questions. Those are the three questions I wanted to ask you, and I think we have a little bit of time left to do like a quick recap. Because every time I meet you in different settings, one of the things I'm always looking forward to hear from you is your recap on COVID and what's going on, because you're in the front lines. And so tell us what's going on. What's the latest on the COVID front
Well,
regarding?
let me preface this. So I want to give the shout out to the people that are working in the hospital. So yeah, yes, I have had it where I've worked in the hospital and in the clinic, but now I'm generally in the office. So yes, I'm seeing out. So I want to just preface it. I'm still seeing COVID
Yep,
and dealing with COVID, but as an outpatient. I'm not one of the doctors working in the hospital. Just to be
got it. From
very,
the penthouse,
yeah,
from the
very,
penthouse.
want to be very
Yeah,
clear. But what I would tell people is that one, I would stress that COVID is not the flu. That's a one thing. This is a very serious disease. Um, I actually, I did a little bit of research, and I thought giving some statistics might be helpful. So I did some research, and there was a study which they looked at the influenza, and the peak weeks between 2013 and 2020, right? And the peak weeks, there are roughly 750 deaths per week. Now, remember, if you go back, think about what comes in the Miami Herald and what we see in the paper, right?
yep,
And the mortality rate from COVID was so much higher than that. So I believe in February of last year. No, I believe it was February. We actually reported over 5,000 deaths in a day in the U.S. So think 5,000 deaths in the U.S. in February, last month, versus looking at the flu, it would be 750 deaths per week in the U.S.
yeah,
And this, of course, being anecdotal, I've been a physician now for 25 years. I know the flu can be deadly, but in my experience, I've never had a patient die from the flu or known of one. I know it happens, absolutely. I can tell you numerous people and people that have been friends, that have passed away from COVID.
yep.
So, one, that it's real. Two, the biggest risk factor that I think people need to understand when you're under 65 actually is obesity, and
Okay.
that's one of the main factors we have in our American society now is weight. Being overweight.
Yep.
I think this is also probably a wake up call for that. I think that these UK variants, South African variants, Brazilian variants, now I've heard about a California variant. We're going to have to see what the research, shows about the effectiveness for the vaccines for this. I don't know. I think initially for the UK and South African, I believe the vaccines that they said effective, but we still need to keep a close eye on that, because I think the variants that we need to just make sure and be aware of that. Um, Other things that I can tell you. What other things would be people interested about?
So, so the fact that even though we're seeing a pullback, right, we're seeing the numbers are getting better. As I understand it, it's not something that you want to lax about in terms of wearing a mask and taking universal precautions, right? Would
Correct.
you agree with that? Yeah.
Yeah. We're probably. I would agree right with that. We may be turning a corner, but we don't want to go too early. So still, protect yourself. The vaccines becoming it's becoming widely available. It's great news hearing about this Johnson and Johnson.
Yep.
All three of them, Pfizer, Moderna, Johnson and Johnson. And I would say, speak with your doctor. Your doctor can be your advocate to help you get the vaccine. There's some forms. I filled out multiple forms today to try to, listing my patient's medical problems so that they could get the vaccine. And then it's not just that, it's finding out, knowing the sites where to go.
Yep.
So call your doctor's office. Your doctor should be helping you. Ideally, someone in your doctor's office should be helping you with this.
So if you're an adult 65 and older, your doctor should be able to point you in the right direction and actually get you vaccinated, right? Get you access to the vaccine,
and
correct?
now it's for a number of people it's less than 65 now. The governor has made some changes in these
Okay.
in the criteria. So different facilities have sometimes different criteria somewhat, but now it's becoming more available for people less than 65. So again, I mean, I would just say really speak with your physician and see if you're a candidate. But I would highly stress, speak with your physician tomorrow, because I think the main thing that's going to help us get through this pandemic is trying to get every U.S. citizen, every person, not just citizen, every person that's here. Ideally, let's try to get them vaccinated.
Yep. And there's still fears. I mean, I still talk to people that are fearful about the vaccine, but it's just mostly I think it's lack of education and getting exposed to the right type of message and the right information. Because as always, people, it's a concern. Uh, but anyways, I again, just like Dr. Trice said, if you're listening, and just go to your doctor, talk to your doctor and try to get vaccinated, start the process going. It doesn't hurt, by the way.
Yeah, just speak with
It's just
just get some guidance, and then there are certain websites and Twitter. Download some of the local hospitals here have Twitter accounts that will release and let vaccine is available. There's some FEMA vaccination sites. Go on the Miami-Dade COVID-19 site. Um, I think that could be really important.
awesome. All right, so Dr. Trice, thank you so much for
Thank
pretty
you.
much educating us on both concierge medicine, what it's like to have a concierge doctor, and the update about COVID. I think that I feel like I should have you over, twice a month, just to talk about COVID and give us a quick update, to our audience here. And thank you so much. So where I know we've been plastering your information all over the place, but if someone wanted to get in touch with you, where could they find you? What's the easiest way to find you?
To the websites, the AgasonCenter.com, or my name, JamesTrice.com. We're located. Our office is right off of Lincoln Road, at 1691 Michigan, right there in South Beach.
Awesome.
5-physician practice, and it'd be our pleasure.
All right. Well, Then again, thank you for coming by. We'll do this again. We'll get a little bit more time next time, but I really appreciate your time and thank you.
All right, sounds good. My pleasure. Thank you. Take care. Good night.
All right, man.
Bye.
All right, everybody. So that's Dr. Trice for you. I'll see you next Wednesday. Thank you for tuning in, and I'll see you soon. Take care. Be safe.